Okay, Madam Chair, we are now live on YouTube.
Thank you very much. Good morning, everybody. It is 9:02 a.m. and I'm going to call the meeting of the Public Employees Benefits Program Board to order, and I will ask PEB staff to call the roll.
Thank you. Laura Freed.
Here.
Linda Fox.
Here.
Betsy Aiello.
Here.
Jim Barnes.
Here.
April Caron.
Here.
Michelle Kelly.
Here.
Leslie Biddleston.
Here.
Jennifer McClendon.
Here.
Tom Verducci.
Here.
Thank you. We have a quorum.
Thank you very much. All right, agenda item 2, public comment. I will limit public commenters to 3 minutes per. And with that, I will turn it over once again to PEB staff.
Okay, one moment, Madam Chair. As a reminder, Zoom is used for public comment only. This meeting is streaming live on YouTube. If you want to just listen to the PEB board meeting, the YouTube link is located on the agenda. For those who have joined for public comment, your name and the last 4 digits of your phone number will be announced and you'll be advised they've been unmuted. Okay. So Kent, Irvin, you have permission to talk. Please unmute your mic.
There we go. Kent Irvin, K-N-T-E-R-V-I-N. Can you hear me now?
Yes, we can, sir. Thank you so much.
Kent Irvin, State President of the Nevada Faculty Alliance, the Independent Association of Faculty of Nevada's public colleges and universities. We work to empower faculty members to be fully engaged in our mission to help students succeed. Full engagement means having a healthcare package that keeps employees and their families healthy and free from catastrophic expenses. A strong benefits program is essential to recruiting and retaining the highest quality employees, but with recent and longer-term cuts to our benefits, PEB is not meeting that requirement. PEB is now a half year into the establishment of the new low-deductible copay plan option. It's time to start evaluating whether it is accomplishing its goal as a middle plan option between the high-deductible plan and the EPO plan. While the utilization report in agenda item 4.2.2 includes lots of interesting details, it does not clearly lay out the metrics that would show how much each of the 3 self-funded plans are working. For example, what are the medical and pharmacy payouts per employees for each plan, both by PEB and by the participants? What are the differences in utilization and access to medical treatment for each plan? Are they priced fairly? In item 7, you will be awarding the contract for the pharmacy benefits manager. The board information lists cost as one of the determining factors for staying with Express Scripts. How much will be saved by participants versus saved by the program? And how will those savings be converted into better benefits for state employees? We are concerned that savings will just accrue to excess reserves, which increased again to $47 million as of the beginning of FY 2022, not including the additional $8.6 million in CARES Act reimbursements. Excessive excess reserves could again be swept by the legislature. Please make sure that cost savings are translated into better benefits or lower premiums for employees. Thank you.
Okay. Thank you, Mr. Irvin. Kurt Kemp, You have permission to talk. Please unmute your mic.
No comment.
Thank you so much. Matthew Parker, you now have permission to speak. Please unmute your mic.
Can everyone hear me?
Yes, we can.
Okay, great. Ladies and gentlemen of the board, I am an unvaccinated state employee who will be subject to the vaccination surcharge going into effect this July. In the last 2 years, I've weathered furloughs and seen inflation corrode my take-home pay. And now I face a surcharge. I'm here to tell you that I and many others like me cannot afford this, and my family cannot afford this. I read the December 2nd agenda to better understand this board's reasoning for the surcharge, and what I found was that a lot hinged on the Biden administration's mandate, which was shot down by the Supreme Court on January 13th. A lot of what is written here also hinges on the misconception that the vaccine is the only way out of this pandemic, which is a gross oversimplification of that is not reflective of the realities of this pandemic. Because what I didn't see in the agenda was no consideration of natural immunity. No mention that COVID hospitalization hinges more on age and comorbidities than it does on vaccination status. No mention that the fully vaccinated can also transmit COVID and be hospitalized for it. Will you also be surcharging fully vaccinated employees due to their age and health? What if a fully vaccinated person is hospitalized for COVID? Will they then have to pay a surcharge? It shouldn't be a surprise to anyone here that the state is struggling with recruitment and retention, and morale in the workforce is very low. This surcharge will worsen recruitment, worsen retention, and is already corroding morale. Right now, around the country, public agencies that have used coercive methods of punishment on their unvaccinated employees are now facing staffing shortages. The state of Washington, for example, lost 151 winter operation workers who did not want to comply with the state's vaccine mandate, which has crippled their ability to keep roads open and safe for travelers this winter. These are the consequences of these strategies to punish employees who remain unvaccinated. They leave. I can tell you right now that many of the unvaccinated I work with are actively looking for other jobs right now. Others may be fortunate to get on another insurance plan. Those who can't will likely feel backed into a corner and get vaccinated, not because they want to, but because they have no other choice. This will leave them bitter, disgruntled, and feel victimized by their employer. Are these the outcomes the board wants? Do you want this to be part of your legacy on this board? I have no doubt the surcharge will be very effective in getting vaccination rates up, but it will come at a heavy cost. And in your effort to fix one problem, you'll be creating many more in its place. As this board has said, the situation is fluid. And since January 13th, the number of private corporations and public agencies dropping their mandates and surcharges has grown every day. So it is with respect that I strongly encourage this board to do the same. It is the morally right thing to do for the people of the great state of Nevada. Thank you for your time and consideration.
Okay. Thank you so much for your comment. Okay, will the caller with the last 4 digits of 1100, please press *6 to unmute. You have permission to talk. Caller with the last 4, 1100, please press *6 on your phone. You have permission to speak. Okay, we'll come back to them. With the caller with the last 4 digits of 7832, you please press *6. You have permission to speak.
Thank you. Can you hear me okay?
Yes, we can.
Thank you. Good morning, Chair Freed and fellow board members, and also Executive Officer Rich and her staff. My name for the record is Terry Laird, spelled Terrilaird. I'm the Executive Director at the Retired Public Employees of Nevada, RPEN. We were formed in 1976 with the sole purpose of protecting the pension and health care benefits earned by all public employees. We currently have nearly 8,000 dues-paying members, many of whom are retired and on the PEB Medicare exchange, although we also represent some active members who are participants in PEB. In December, I did express our concern about the pending COVID surcharge set to take effect in July for those non-vaccinated public PEB participants. And we see the board has several letters from those participants for your consideration today who were not heard in December when this surcharge was approved. We do recognize the need for PEB to cover the testing costs these non-vaccinated employees incur and understand the seriousness of the pandemic. However, more fees on top of already high healthcare premiums and deductibles could prove a problem for some of the lower paid employees in your program. Affordable healthcare seems to get less and less affordable as the years go by. We are also still hopeful PEB can benefit from some of the millions in federal funding made available to states last year and hope to see some of those benefits cut last year at PEB restored with some of that aid. It looks like the pandemic is not over yet, so we hope the governor, who informed PEB they would not get any additional funds, might perhaps change his decision in the coming months. A last concern of ours relates to the health reimbursement arrangements, HRAs, for some retirees after we got word earlier this month that some of our members were having concerns with PEB's enrollment platform. We do understand from Ms. Rich it's a glitch in the system, but we hope that that can be taken care of before it goes on too much longer. Until then, we do thank the PEB board and staff for your difficult work during these trying months. Thank you.
Thank you so much. Will the caller with the last four digits of 8673 please press *6 on your phone? You have permission to speak.
Good morning. Thank you for the opportunity to be able to speak to you again. For the record, my name is Brooke Nailap. I'd like to again call your attention to the discriminatory language in some of the plan documents, specifically the PEB Consumer-Driven Health Plan, which mandates that the pre-certification requirement applies to medical treatment related to hormone therapy and prescription drug therapy by the pharmacy benefit manager for treating gender dysphoria. This is really the same kind of issue that menopausal women have in being able to get hormone replacement therapy to be able to treat the symptoms that come about during menopause. They go in, the doctor, makes the diagnosis, the doctor prescribes the medicine. There's no pre-certification that is necessary. Whether you're a trans man or a trans woman, being able to have the dependence on an outside agency that's never laid eyes on you for a diagnosis, and to have to be able to jump through those hoops because of administrative barriers is, in fact, discriminatory. This is an easy fix that can be made immediately in a self-funded plan, and that's what we've been asking for months. The plan also goes on to say that the utilization management company may refer to guidelines published by organizations such as the World Professional Associations for Transgender Health, also known as WPATH, Aetna, and a few other insurance companies. I will tell you right now that the WPATH standards and the Aetna standards are for the ability for prescribers to write those prescriptions without having to go through a utilization manager or a psychological review, that it is a self-informed, informed consent model. And this plan should reflect that kind of model as those professional organizations have already adopted and as already exists in the other self-funded plans, presented by PEB. This plan needs to be changed because it is, in fact, discriminatory. And we don't want to be putting the state in a place where a lawsuit can challenge that kind of language, and you can and will be held liable and have to pay not just the cost of the prescription, but additional costs and penalties, lawyers' fees, etc. So please just do the right thing and eliminate this as quickly as possible. It's a simple fix, and it's one that has to be done in order to meet the requirements of the law. So thank you for your time, and I look forward to action happening and not just silence. Thank you.
Thank you so much. It looks like we don't have any more public comments on the line currently. For those who have technical issues and didn't get a chance to comment, we will have another public comment session at the end of this meeting. Madam Chair, the public comment has been completed.
Disclosures for applicable board meeting agenda items, and I'll toss it over to the Chief Deputy Attorney General, Ms. Briggs.
Thank you, Madam Chair. This is Michelle Briggs. For the record, this agenda item is to allow me to make a disclosure regarding conflicts of interest on behalf of the board members who are eligible for PEB benefits pursuant to NRS 281A.420 on behalf of the board members who are eligible for PEB benefits or whose family members are eligible for PEB benefits. I offer this disclosure that they will be voting on those items that may affect the benefits available to them or their family members. The law does not require abstention from voting merely because the board member or their family member is eligible for PEB benefits. At this time, I invite any member of the board who has any other additional disclosures to make them now. Thank you.
Thank you, Ms. Briggs. I have no disclosures. I just want to say how much I appreciate the cat tail in the background.
She does that.
They have a tendency to. They crash. All right. So with that, let's go on to agenda item 4, the consent agenda. All these are action items, as you know, board members, and as is our habit, I will ask you if you'd like to pull any of these for discussion.
This is Betsy. I have a couple of questions on 4.6.
All right, 4.6. Board members, any others? Oops, now my pen won't work. Any others you'd like to pull?
Yes, Tom Verducci for the record. I'd like to pull 4.2.1.
Okay.
4.3.5.
4.3.5, okay.
4.3.6.
All right.
And lastly, 4.5.
Oh, good. Me too, on 4.5. Okay. Any others? Okay. Hearing none, then I'll accept a motion to approve everything in item 4, save for 4.2.1, 4.3.5, 4.3.6, 4.5, and 4.6. We'll hold those for discussion in a separate motion.
So real quick, my name is Dylan Garrison. I am the external auditor, the manager on 4.6, the Clifton Larson Allen audited financial statements. I just wanted to clarify that the statements we have today, I don't know if everyone has a copy of them, but they're draft financial statements, so they still remain unaudited at this point in time. We're still working through required auditing procedures and going through that review process over those. So I just wanted to make sure that that's clearly identified that these are still unaudited at this point, and we'll be presenting the final audited financial statements along with the results of the audit at the March meeting. Thank you.
Thank you, Mr. Garrison. Executive Officer Rich, with that in mind, do we want to shelve 4.6 until March? Or is it important that you have us accept this draft report?
So we can shelve it. The reason that this was submitted in or included in this packet is because these are typically included in the November packet. Right. They're presented to legislative committees. And so before that gets presented publicly anywhere else, we wanted to make sure that the board had an opportunity to at least review it. So we will definitely be bringing the final results back in March, but we didn't want to. We wanted the board to at least be able to preview these before they became public elsewhere.
Right, understood. It has to go to the Interim Retirement Benefits Committee. So I appreciate the consideration shown to the board and giving it to us first, even if it was in draft. All right. Okay, then that's fine. I'll leave it for now. So anyway, back to the motion for everything on item 4, except what I previously called out. Do I have a motion for approval?
This is Leslie, so moved.
Thank you. Do I have a second?
This is April, second.
Thank you. All in favor, say aye.
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 Aye. Any opposed, say no. Okay, motion carries. All right, with that, let's go to 4.2.1, the budget report.
Yes, Tom Verducci for the record. In reading through the report, I just wanted to see if we could address the differential cash that was available. I read 37 million. I heard in public comment that it was 47 million, and I just want to see if we can get an accurate reading on the differential cash that's available on the current budget.
This is Carrie Eaton for the record. I am unsure of where the number from public comment came from. As this report reflects, it is 38.1 million as of this time.
And this is Laura Freed. And I want to note that at the last meeting, we chose to set aside 26 million of that for future plan years benefit enrichment. So 38 minus 26 leaves us about 12 million at this point, knowing that that's always fluid. Is that correct, Ms. Eaton? Or correct enough?
Carrie Eaton for the record. Yes, that is correct enough
Okay.
at this point in time.
All right. Thank you. Mr. Verducci, any other questions about the budget report?
That was the one question I had on the budget
Okay.
report. Thank you very much.
All right, you're welcome. 4.3.5, again, Mr. Verducci, I believe this was, you had questions about this one?
You know, I sure do. I see that there's been a performance guarantee that was missed on 4.3.5. And, you know, I also noticed on 4.5, I know we're not there yet, but that had audit findings relating to the Willis Towers Watson guarantee. And I'm not sure if we have a representative from Willis Towers Watson here. Maybe we could perhaps have a discussion on the performance guarantee and you know, why those measures are being missed, or if indeed they are being missed.
Yep. Hi, Mr. Verducci. This is Chris Garcia with Willis Towers Watson. I'm here for you.
Oh, hi, Chris.
So going to the quarterly report, which measure are you referring to? I'm looking at page 5 of that report. I'm sorry, page 6. And I'm not seeing that there was a missed measure for that quarter.
Okay, so going to page number 4, okay, page number 4 under the category of benefit administration customer service abandonment rate. And I know the commitment is less than 5%. When I tied it into the audit report at 4.5, it looks like the findings were closer to 9%. And it, you know, the performance guarantee, which, you know, I think is either yes or no, the response is NA. I don't know if that's not applicable or not available, but that's the item I wanted to discuss.
No, thank you. I appreciate that clarity. Again, Chris Garcia for the record. So that is listed as NA because that is not a quarterly measure. That is an annual measure. So this report is providing information on a quarterly basis. And you're correct, the audit report from Claims Technologies, that would be where we would capture the annual measure. So hopefully that explains why that's listed as NA in the quarterly report. And then if we're ready, we can go over and look at the Claims Technology audit report if you like. I don't know if we have to close out this particular item first before we can move on to the next.
We don't necessarily, but I think I'd prefer to go in numeric order. So we'll, if you would hold for a second, Mr. Garcia, I'll go to 4.3.6 unless Mr. Verducci has more questions on 4.3.5.
No, thank you very much, Chair.
Okay, then, all right, then I'm going to throw it back to you for 4.3.6 Aetna signature administrators.
Madam Chair, Aaron Keller from Aetna was having some technical difficulties. We are
Okay.
trying to get her in at the
Oh,
moment, so.
Okay. Well, then I take it back. Mr. Garcia, you're up again, 4.5. Yeah, and in fact, I think I'll start this one off. Hold on, let me get to the right page in my packet. So, so Claim Technologies has, on page 9 of its audit, it's got some recommendations. It asks via benefits to specify the reason for overpayments, train its examiners to combat claims processing errors, track turnaround time, all these things. And then in the Willis Towers Watson response, it was curiously devoid of responses to those recommendations. It just talks about more like the procedural way that CTI did the audit. So yeah, I'd like to hear from Willis Towers Watson what its reaction to the recommendations are, and I'd also like to hear about. Hold on page. They talk about assessing a penalty of. On page 3 of the audit, claims processing payment precision annual review, it was not met and the penalty is $10,000. So would Willis please respond to that?
Absolutely. Again, Chris Garcia for the record. To respond to the first part of your question regarding the recommendations from Claims Technologies and why the response letter in the report doesn't address that. This response letter was provided to a draft version of the report that our auditing team had received. And in that draft version, there were no recommendations listed in there. So that's why the letter itself that Kara Smouse from our claims auditing team did not provide any additional information related to those recommendations. But I'm happy to respond to many of those recommendations during this call if you'd like to.
Well, actually, what I'd like is if that was a draft, now that this is final, will we be getting another response letter from Willis directly responding to the recommendations? And you can preview that for me if you want to.
Sure, and we certainly can. That was not a request that we received. We did not get the final draft or the final report until it was made public through PEB posting it out onto
the
website.
packet. Okay.
Correct.
Got it.
So when we requested the report from Claims Technologies, I was advised by our auditing team that we were told we would need to get it from PEB when it was made available.
All right. Okay.
So we are happy to provide a formal response, or I can go ahead and talk through that information if you prefer.
Actually, I'd prefer both. I'd like.
Great. No, I'm happy to do that. So looking at the recommendations, the first recommendation is regarding the overpayment report and the request for additional details to be added to that report. Currently, the report that we have available does identify the type of overpayment that was created. The two categories are what we call a negative account balance overpayment, and the second one is a claims overpayment. And they're very generic, and I understand how that can be a little concerning from an auditing perspective or from an auditor perspective. To simplify this as much as possible, a negative account balance overpayment is typically tied to a reversal of funding that was provided to an account. For example, if we receive a late notification that somebody has passed away, we will, because PEB provides monthly allocations, we will go back and remove any of those monthly allocations that the person should not have received during the time period from when, before we were notified that they were passed away. If we remove those allocations and there were claims paid from those funds, that would potentially cause an overpayment to be created on the account. That's the first category. The second category, as I mentioned, is claims overpayments. And those are typically going to be tied to claims that were originally approved and then later determined to be an ineligible expense. A common example of that would be a claim that was approved and then later identified as a duplicate claim. And we do see that every once in a while, in particular with premium claims that we can receive. So while our current overpayment report does not provide the more detailed information on why specific overpayment occurred on an account, we would have to do manual research on each individual claim item to identify the specific reason why a claim isn't currently in overpayment. I do want to advise PEB that we are working on reviewing improvements of the reports that we make available to clients through what we call our benefit view site, which is where the overpayment report is housed. There's actually, coincidentally, there's a meeting later today that's happening regarding those types of improvements. One of those reports under review is the overpayment report. However, I'm currently unable to confirm that additional detail can be provided to the report at this time. It's got to be fully vetted and reviewed, but this has been something that's been building up, not specifically based off of this request, but actually over the last year as we've received feedback from other clients related to the reports that we have available, and specifically to the reports available on our benefit view site tied to the HRA. Okay. So certainly something that we wanted to look at and make improvements on, but it's got to be reviewed to see how we can add additional detail as to why the overpayment was created on the account. Did you have any questions on any of that information?
No. Mr. Verducci, I see you're unmuted. Did you have questions about that, or were your questions different than mine?
I believe they're probably a little different.
Okay, go ahead.
I wanted to go ahead and ask about the number of the HRA accounts. I read 13,462 accounts are out there, but 7,315 don't have any balance. I was just trying to account for the over 7,000 accounts with no balance. It seems like a kind of a big number there.
And that's actually a really good thing, to be honest with you, Mr. Verducci, and again, Chris Garcia for the record. So as PEB provides monthly allocations, we're paying out claims on a daily basis. For most clients or most participants, they want to utilize as much of their HRA as possible. So as we have claims come in and we have new allocations added each month, we will process those allocations, those balances against the claims that are being submitted. There's different ways that participants can submit claims against their account. So as we pay out those claims, it exhausts the balance. And so we will use up as much of that funding as possible so that the participant can receive reimbursement for their eligible expenses that they submit against their account. So we would honestly prefer to see that be a higher amount on a regular basis, more than the 7,000, just to show that participants are utilizing as much of their HRA as possible. In particular, because as you may recall, last year, the board implemented a cap of $8,000 on the HRA. So at the end of May of each year, any amount over $8,000 is removed from the account and is no longer available to the retiree. So we do want to see as many of those retirees use as much of that, much of those allocations in the balance as possible, so they don't go over the $8,000 and lose their funding.
I see, and thank you, Chris. So those would be zero balance accounts that did have balances at one point, but they were closed out. And is that something that is just held on the books indefinitely going forward, even if an account was closed out perhaps several years ago?
Well, they don't close out unless the person either loses their eligibility or they become deceased. So those are really the only times that an account is quote unquote closed. When we mean by they have a zero balance, it means that at the end of that reporting period, the account had exhausted their funding. But then at the start of the next month, they would have additional funding added to the account. So to kind of give you a simple example, let's say a participant is receiving $260 per month, which is the most that they can receive based off of receiving 20 plus years of service at $13 per year. If they receive the $260 per month and then they have premium claims for their Medigap and maybe their Medicare Part B premium, dental premium, et cetera, that exceed the $260 amount, we will load the $260 to their HRA, make it available to them, and then pay out claims as they come in. And So by the end of the month, they've already exhausted that $260 as we've reimbursed them for their expenses. So every month they're exhausting their funding, but they're getting new funding at the start of the following month. That's the most common scenario that we'll see that applies to those 7,000 accounts that you mentioned.
Thank you for the detailed explanations. Appreciate it very much.
You're welcome. Again, Chris Garcia for the record. Ms. Reed, did you want me to continue on with the questions, the recommendations?
Yes,
and our
please.
responses?
If you,
Okay.
yeah, briefly. I mean, we don't need to spend too much time, and I don't want to
Sure.
put you on the spot for like a half an hour. But so what I think I'm going to do is have you do it briefly, and then ask you
Sure.
to formally respond, whether it's from from you or from Kara Smouse or whomever in your organization needs to respond to CTI and us officially.
Absolutely. And I will go as briefly as I can. So item number 2 in the recommendations was regarding how VIA Benefits and LifeWorks needs to work together to determine how to best update eligibility in a timely manner. So just to confirm, we are now working with Benefit Focus as of 2022. And one of the things that we've been focused on working with Benefit Focus as your data eligibility vendor is improving the timing of the eligibility files that we will be receiving. We're still working on that, but our goal is to expedite that timing and improve it compared to what we were receiving, the timing that we were receiving files from LifeWorks, your prior data eligibility vendor. So we are excited to be working with Benefit Focus and hope that the improved timing of those files will minimize the number of late notifications that we receive, especially related to a deceased participant. I do want to add one item of note that we are currently working on a tool that will be available to clients as well as authorized third-party eligibility administrators that would allow the client or that third-party administrator to actually access our system in their participant accounts and manually update information in that account. We can see that being used to help correct an account, or potentially I could see it being used to update a death status rather than waiting on the next file that would have to be sent over. That tool is called OneView, and we plan on rolling it out by the end of this year. So I'll share that information with PEB as it becomes available, as well as with Benefit Focus. But one thing I wanted to bring to your attention, that's something that could come into play here. Moving on, any questions related to that? Okay. Moving on to item 3, which is regarding how VIA Benefits should coach our examiners on the claim error processing. Our claims manager did confirm with me that they do coach processors on all identified errors. And they actually did share the report that Claims Technologies has provided with the processing team. So that item has been addressed. The next item is that VIA Benefits should develop a process to track what they call claims turnaround time, which is how quickly we process a claim from when it is received. Again, our claims manager has confirmed that we do have a process to track turnaround time. They have several controls to monitor aging inventory on a daily and weekly basis through reporting and dashboards. And we receive reports monthly to determine what we call service level agreements on a quarterly basis. So usually SLAs or service level agreements are tied to a quarter. So we use those reports, those monthly reports, to do that. I think what Claims Technologies may be asking for is like a turnaround time on demand report, which is not a report that we have in place because the previous controls that were mentioned would eliminate the need for that type of report. Again, we'll provide more detail in the written response. The item 5 is an item related to performance guarantees metrics or service level agreements, and being able to measure those outside of to allow for outside validation. I actually had some questions on this one. I don't think we have a response ready. We wanted to ask Claims Technologies for some additional clarification on this item, and then we would be able to provide a response. So we can certainly do that. And then the last item where it says PEB should verify that missed performance goals have been credited back. Unfortunately, I can't provide a response there. We would need PEB to respond to that item or provide information.
Okay, right.
Any other questions that you might have?
No, sir, none from me.
Okay.
I think with that, we can move
Can
on.
can I just add something to that really quick? First of all, this was, as the board is aware, we switched auditors, and we had a longtime auditor. Gosh, we had Bob Carr for a decade, I think, and so we had. After Bob Carr retired, we switched to a new auditor. This was the first audit that we've had. So there have been, this is, can you hear me?
We can, Laura. It is just very muffled. There's like some feedback.
There's a lot of feedback on yours. It's weird.
Can you hear me now better?
No.
Let me see what I can do here.
Where's the thing you typed last night? Where's the thing you typed last night?
Okay, everybody, thank you for your patience, both board members, vendors, people listening on the internet. We've had some audio difficulties with Executive Officer Rich. So while they get that sorted out, I think we will move on to 4.6. I believe that member Aiello wanted to ask about this one.
Yes, it was me that had asked to pull that one. And I think it's not so much about the audit report, but a couple of the things within it that I don't quite understand. And maybe we've seen them before and it was in a different presentation, so it made sense. But on the Fund 625 on page 4, it talks about bank overdraft. And later in the report, I read that there are some outstanding checks that made sense to me that that's part of the overdraft when things have been paid and need to be brought back, but it was a smaller amount. So I'm just wondering what bank overdraft is. And I don't know if that someone can answer that for me, but this report brought that up.
I will ask the auditors to ring in if they can answer that question for you. Okay.
I can go through my other questions if they're having trouble getting on and while they're working, maybe. Or
we are just riddled with technology issues today. I'm not even seeing the auditor on, and he was here previously.
This is Carrie Eaton for the record. I can take a stab at it with maybe I am wrong.
I
believe
just
that-
know in my own accounts, I wouldn't want to see bank overdraft.
And I don't know if that is what they are calling our stale dated checks, or if that is something different. But I'm not sure if you might also be seeing our collections, because there's a collections amount that we have participants who are overdue on payments and we send them to collections, and part of that becomes uncollectible. And I don't remember where in their report they go over that, but I know they go over both of those.
Okay,
So
that
those
was
are the
just
two areas that are coming to mind.
Yeah, because it was over $2 million, so it just seemed like a lot. On page 5, my question was just in the transfers section, it says transfers in. Where do transfers come from? Because in 2020, we transferred in 400,000, and then in 21, we transferred in over 9 million. So I was just curious where that money came from, or that's another question I had. Just trying to understand what I'm
Okay,
reading.
so I'm going to thank you, Betsy. I think what we're going to do is take a break because we seem to have tech problems and we're missing an auditor somewhere. So board members, vendors, and the public, I apologize that this is happening, but I think we are going to pause the meeting for till about 10 o'clock so that Executive Officer Rich can get her mic back to where it needs to be, and we can maybe find some people to answer these questions. So with that, everybody take 5 and get a beverage or something.
Taking a break. I don't know if that they can still hear us talking.
Can you guys hear me now?
Yes, that is much, much better. That is normal.
All right, so I'm going to try going back to the soundbar and I'm going to see if that changes things. Hang on.
I wonder when that do not call becomes effective. Maybe you should just go in there and see. I think it's called something like donotcall.org or something. Just go and Google and say, what's the website?
Okay, I just changed it and you guys.
On this thing that you typed last night, we need to get the correct amounts, like the $88. What is it, 88.57 or whatever it is?
Mr. Barnes, your mic is still active.
Mr. Barnes.
I unmute him.
All right, can you guys hear me?
Yes.
Yes, we can.
You can hear me clearly?
Yes.
Okay, perfect. All right. Do we have the auditor back? Sorry.
Not to my knowledge, no.
I have messaged him, so hopefully. But I don't see him in the participant list.
No, I don't either.
I'll call him real quick as well. Okay, I just got a hold of him. He is logging back in.
Hello, this is Dylan Garrison here. Carrie just called me and said we were revisiting the agenda item for the draft financial statements.
That is correct, Mr. Garrison. So stand by.
All right.
Okay, everyone. It's 10 a.m. I think I will call the meeting back to order. And we were on item 4.6, which is the financial audits of the two funds that PEB has. Member ALO, we have the Clifton Larson Allen auditor on, so if you'd like to pose your questions once again, we'll let Mr. Garrison answer them if he can.
Thank you. For the record, this is Betsy Aiello. And Mr. Garrison, I was just trying to understand what I was reading. And on page 4 of your 625 audit report, it indicated under current liabilities, bank overdraft. And I was trying to understand what that was.
And Mr. Garrison, before you testify, if you'd identify yourself for the record.
Yeah, my name is Dylan Garrison, and again, I apologize. I thought we didn't have questions over these documents, or else I wouldn't have jumped off. So I apologize on that one. So the bank overdraft, what that is it's the 3 checking accounts that are held by that third party. So really, it's those outstanding overdrafts where those checks get cut to the claim participants that are filing the claim. But the state of Nevada, the PEB funds are liable for those claim payments up to 6 years. So those are the 3 checking accounts held by the third party that are constantly getting cleared out. And so those bank overdrafts, if you will, are still those outstanding claim payments related to those 3 zero balance accounts administered through a third party.
Okay, thank you. I thought I saw that in a note lower, but I thought it read a different amount than those amounts. So.
And you're that's a great point, Betsy, and you're right. So that footnote was, and I'm assuming you're talking about either number 3 or number 8, probably. But in that batch of what's listed on the basic statements, it does contain these amounts that are disclosed, but it also just has additional just activity reported in that bucket, if you would, for a liability.
Okay, I appreciate that. And then I just had another question on the next page, on page 5.
Sure.
Where do transfers come from? Because apparently in 2020, we only had to transfer in 400,000, but this year we had to transfer in 9.5 million.
Yeah, so it's kind of it's a hard picture to see, right? Because you're just seeing the 2 funds that we're reporting on versus seeing the whole statewide annual financial report. So those transfers in are coming from the general fund. And so I believe a good portion of that money was related to the federal grant money that came in, I believe, in terms of that transfer of funds, because this is a transfer in from the general fund. So this is money that the general fund has transferred
to help
into the
PEP with their bills or whatever.
Correct. Yeah. And I think, and just another item, and I don't know if anyone has really noticed it or kind of caught everyone's attention, but you'll notice the operating income is a lot lower this year. And the reason that is because the month of June, the state had a subsidy holiday is what it's termed as. And so what ended up happening is those employers that would typically contribute, to these 2 funds we're looking at here, which would be recorded as revenue, that June contribution amount got absorbed by state dollars as like a state subsidy holiday. So really that 2021 column is only reflecting 11 months of revenue because that month of June was absorbed by the state as a subsidy holiday that it offered all the employers. So that was one of the biggest. Oops, sorry, go ahead.
I'm sorry, I interrupted you, but which then was backfilled from the general fund, probably from federal funds, but from whatever.
Exactly.
That was part of the reason the 9 million maybe was needed.
Correct.
I'm assuming, okay. And then I have a question on page 6, and this one's an easy one. There's only 2020. Is that a lag report? Is that why there's not 2021?
Not at all. That's just because these are drafts, and we didn't quite get that column updated for this board meeting, and we were kind of pressing the deadline, working with the finance department, and we wanted to get drafts available for this meeting, so that there should be a 2021 column there. for the cash flows for this fund. So great point. There will be another column there when you see the final financial statements.
Okay.
Yeah.
And then I just have a question on one question only on the 680 report, because my eyes were going a little crazy just trying to figure out what I was reading. But and that also is, I'm scrolling to it, sorry, on page 4.
Sure.
To it. And this is the retiree stuff.
Mm-hmm.
And I'm wondering why, let's see what I wrote. There's such a decrease in assets from 6 million to 2 million. What would, or maybe you don't, because we've got a whole bunch due from other funds, due that they're blank this year, or investment at fair value, and yeah.
Yeah, no, great questions. So there's a couple circumstances there that are taking place. So the investments at fair value, that was an investment account that last year had a balance that was essentially swept in March of 2021. So those investments were moved to another fund at the state level. So that's why that has been decreased. So it was essentially removed off of Fund 680. And then the due from component units was related to INCHES, the higher education. And so that kind of ties into the June holiday amount. So I think in the past, the due from component units related to those June retiree contributions from INCHES. And so with this year being a state holiday for the month of June and that getting absorbed in the general fund, we didn't have revenue or receivable to report related to the component unit at the statewide level. And so that's why that went from 1.4 million to 0 this year, just because of that state subsidy holiday, as it was very unique. But because there was no activity for the month of June, there was no receivable to put on the books for that June amount.
Okay, wait a second. Yeah, this is Laura Freed. Mr. Garrison, I want to clarify something.
Yeah.
Betsy had asked earlier about the transfer of 408,891 in 2020 as compared to 9,467,584 in transfers in. You mentioned they were from the general fund. That would be true in 2020 because that was a transfer that was general fund to support the non-state retirees remediation budget, but that law expired by limitation. So the transfers in from 2021, I believe, would be coronavirus relief fund for claims offset, not general fund. This is not a fund that gets direct general fund appropriations.
And I'm sorry, let me clarify my words. I was just meaning that I think it came from the general fund because the grant funding was initially recorded in the general fund. So this is just a transfer.
Oh, goody. We're talking about fund accounting.
Yeah,
now.
Yeah.
Okay.
So my apologies. I'm probably mixing in my terms with maybe different terms that you guys would be using, but you're 100% correct, Laura. That's exactly what it related to.
Okay, thank you.
And then on this same page, then obviously our net position this year is almost 10 million negative. And that just means we dropped that much with money, or is this fund like in a negative position or?
Yes, I think if you go to page 5, you'll see last year it was like at a negative 5.6.
Yeah.
Net position, and now it's at 9.9. And so I think really what the reason that is, it's going to relate to the June revenue that would typically get reported in that contribution bucket up there. So where you see it says contributions and employer contributions, you can see how that went down by about the exact number, probably 4.3 million roughly, maybe. Just quickly doing back of the napkin math, but that's all related to that June month of contributions that this fund is not collecting revenue for, because the state is going to essentially absorb that cost. So that's why now we had a kind of a similar change in net position. I can't speak to exactly why the 5.8 million was there in prior year, as this is the first year we were the auditors. But that's why we have a change this year of a negative 4.3. It's because the revenue for the month of June did not come through for that contribution bucket.
But so what I'm reading is that in this fund, we use more money than gets put in, because there was a negative at the end of last year, about 5.5 million, and the net position beginning of the year was a negative 5.5 million. we had money put in, and then we obviously paid more than we had put in, and we were already negative, so we're negative even more. So the retiree fund's kind of negative, and maybe this is something that PEB people can help me understand, or I don't know, just from my own accounts, if it was me, I'd be really upset if my bank looked like that, but it's not the auditor's issue, it's something else, I think. Okay.
Let's see, this is Carrie Eaton. I can sort of address that. This is our REGI state subsidy funding, and REGI has historically been a little bit underfunded while AGIS is overfunded, and we can't combine the two. It's a budgeting, legislatively how we set rates issue. So there's no real easy solve for this, and we do need to look into a way to maybe try to lessen this issue. But the way we currently set rates and budget, this issue is going to continue.
It's to keep the retirees rate the same. And I think we might have had a similar conversation last year. And I'll plead that since I'm a retiree, maybe that's why it didn't fully stick with me, or maybe because I'm looking at it just once a year, because some of this is, but I think as that amount gets higher and higher, it looks a little more concerning too, but I appreciate that. Thank you.
I 100% agree.
And my questions.
Okay. If no one else has any other questions about the draft audit, then I will thank Mr. Garrison for his testimony. Welcome to the PEB board, Mr. Garrison. And I will accept a motion to accept items 4.2.1, 4.3.5, 4.3.6, 4.5, and 4.6.
Tom Verducci for the record. I just wanted to clarify on 4.3.6 on the performance guarantee summary. The reason I pulled this item here was I wanted to discuss the repricing accuracy. It appears that there was a performance guarantee that was missed, and I just wanted to see if I could gain a better understanding of that reporting category.
Do we have Erin on now?
I do. I am on. Thank you, Laura. And for the record, this is Erin Keller from Aetna Signature Administrators and Board Member Verducci. Thank you so much for your question, and thank you all for your patience while I work through the technical issues. I believe you're looking at a report that has what we would refer to as quarter three. There might not be for the claims repricing accuracy. It says our standard is 97%, and there may not be anything listed with regard to the results. If I have the right report that you're looking at, Board Member Verducci, and we actually, our repricing accuracy amount for that quarter was 99%. So we did exceed that 97%.
Okay, that answers the question. I was reading 97. It was a very short report with 3 items on here, and it was stated here at 97, which I believe is not a pass, but if indeed that is 99%, it appears to be a pass.
Yes, absolutely. So the 97 for the accuracy, the claims turnaround for 3 days is 97, and the 5 days is 99. Those are the standard metrics. And then on the right-hand side, those are what we have achieved.
That answers my question. Okay, thank you very much.
Thank you so much.
Thank you, Mr. Verducci. Thank you, Ms. Keller. I apologize that I completely forgot that we had trouble having Ms. Keller on the line. Okay, with that, do I have a motion to accept these remaining items?
This is Betsy. I'll move so.
Thank you. Do I have a second?
I'll second. Michelle Kelly for the record. I'll second.
Okay, I'll let Ms. Kelly have that second. Thank you so much. Thank you, Ms. Fox. Okay, all in favor, say aye.
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 Any opposed, say no. Okay, Motion carries. That gets us through agenda item 4. Let's go to agenda item 5, Executive Officer Report.
Sure. For the record, Laura Rich. So the Executive Officer Report is a lot of things COVID. We will start with the COVID update, which begins with the emergency declaration. Nothing unexpected here. On January 14th, the feds did extend the emergency, the National Public Health Emergency. And that is extended through April 15th of 2022. So that means that, certain benefits are extended as well. That's that cost sharing for the COVID-19 testing and test related visits, as well as the vaccine administration. The next one is the OSHA mandate. So the OSHA mandate it actually made it to the Supreme Court. That emergency temporary standard, which imposed testing requirements on large employers, was blocked by the Supreme Court on January 13th. However, and I know this has come up in public comment quite a bit, this outcome does not affect the governor's policy of mandating weekly testing of unvaccinated employees. So this would not affect the surcharges or the costs associated with that, with the weekly vaccine requirements of unvaccinated employees for the state. The next one is the insure mandate. This is kind of a complicated one. It's fairly new. We're still working through a lot of the details. I made our best attempt here to provide some information on where we are today on the insurer mandate. So on January 10th, the Departments of Health and Human Services, Labor and Treasury, they all released guidance outlining a new policy requiring insurers and group health plans to cover and or reimburse covered members for up to 8 at-home over-the-counter COVID tests per 30-day period. So that's 8 per person per month. The requirement began on January 15th. So, there wasn't a whole lot of time to get this implemented. Insurers nationwide were scrambling and still are. So this requirement does go through the end of the public health emergency period. So under this policy, insurers, they're incentivized. They're incentivized by that $12 cap, and by capping it at $12, because if insurers can make arrangements with a network of pharmacies that allow members to go to that pharmacy and purchase, and when I say purchase, it means that you can go and get your 8 tests over the counter without having to pay anything out of pocket. And so without having to go through that reimbursement process, et cetera, et cetera. The motivating factor here for insurers to do that is that those tests are capped at $12, right? So they can cap that reimbursement at $12. Should insurers not take this approach and just use the reimbursement process completely, then that cap does not exist, and then you're reimbursing at the actual price. So, there was short notice. Obviously, we had a whole whopping really 4 days to put this into effect, and so PEB worked mainly with ESI, because this is going to be a pharmacy benefit versus a medical benefit, since it is eventually going to flow through the pharmacies. So we worked with ESI to come up with a game plan. And so ESI today, I know that, and we do have representatives from ESI if there's any questions, but I know that they're still working through some of the processes. There's not an option to do this through that network of pharmacies where people can go to the pharmacy and get something, get their over-the-counter test at no cost. Right now, we do have to use that reimbursement process. It's somewhat manual, but ESI is working to put these all into place. We expect this to be happening here quickly within the next 30 days. In the meantime, those on our self-funded plans are able to be reimbursed through a manual reimbursement process. They will have to complete a form and submit the receipts and receive reimbursement for those tests. PEB has put out communication, and unfortunately, things change, and so will be updated communication. But the original communication said that members had to go to the pharmacy to purchase these over-the-counter tests. It turns out that now Amazon and other retailers are covered as well. So we plan to put out more communication as this is worked through and the details get worked out. So that is for our self-funded plans. The HMO plan through HPN, that their situation is a little bit different. Members can purchase over-the-counter tests at any Walmart pharmacy with no upfront costs. They are able to, they've got that network in place through Walmart, and they can also submit receipts through their online member center as well to get that reimbursement if they choose to purchase their test elsewhere. So the impact of this mandate, this is largely going to be dependent on COVID and what happens with COVID, right? Because right now, it is difficult to get your hands on tests. There is low supply. And so it's the likelihood that members are going to go out and purchase 8 tests per person that are covered is pretty minimal, right? Because you can't find those tests. It is very difficult to get your hands on those tests right now. Should supplies become available and infection rates and perhaps future surcharges surges, got surcharges on the brain, future surges occur, we could see a spike in claims because you're going to see, similar to the toilet paper scenario that happened at the beginning of the pandemic, people will stockpile, right? And so there's a significant chance that in that kind of situation that we'll see a spike in claims because these claims or these costs do come at a cost to the plan. On the flip side, you do have the argument that that these tests at $12 a piece are still cheaper than a PCR test. And so a PCR test can cost anywhere, just say about $130 is average, right? That's a Medicare reimbursement rate. So there's the chance that those PCR tests won't be billed to the plan, and instead the new cost of the over-the-counter test will replace the old cost of a PCR. The only caveat to that is that PCR tests, many of them, have not been charged to the plan to begin with. PCR tests have been charged either to the feds or there's grant funding. Many places that you go to don't even ask for insurance. And so when you go and get tested, insurance information isn't collected, and therefore it is not charged to the plan. So there's a pretty high chance that the PCR, that this is not replacing the over-the-counter cost is not replacing the PCR test in all cases. So there's a whole lot of factors at play here. We're going to be watching this very closely, but this is definitely an unfunded mandate that does have the ability to impact the plan. So additionally, so let's get into the surcharges a little bit. There's not a whole lot of movement here with the focus on the testing rollout. We've been working on that and the implementation of the new enrollment system. There's not any substantial updates to provide on the implementation of the surcharges into the system. We want to make sure the system is working right before we start working the new implementation of how to handle the surcharge in the enrollment and eligibility system. However, some discussions have begun with the governor's office, and we are working on getting those details lined out so that we are in a situation where we can roll this out here quickly. We've also been working with Benefit Focus to ensure that this is a function that can be turned on fairly quickly. And we're going to continue to work with Aon to monitor and ensure that, we're looking and tracking these COVID costs and surcharges to ensure that the surcharges that were those amounts that were approved at the December 2nd meeting still remain accurate and valid. So before I get into staffing and all the other stuff, I'll just stop there and we can address all things COVID first.
This is Betsy. I do have a question. Some of the public comment has indicated that they're already looking for the religious medical exemption process. And I hear you guys are working with the government office on developing it. Is anyone getting back to folks to let them know there will be one, but it hasn't been developed yet? It's in process, but so that they know at least there will be one, because some of them look more like they were questioning whether there would be one.
So there's no information has gone out on this yet, just because of the lack of details that are available yet. However, we haven't put out our January newsletter yet. We will be very, very soon, hopefully by the end of January. And that does include some information on it. So we'll make sure to add maybe a little line about the exemptions, and that there will be a process for that, and details will come out once that process is identified.
I think that's this, Betsy, again, I think that's worthwhile because it may set some people's minds at ease. They may not qualify, or they may, but it may,
Any other questions on COVID before I move on?
Yes, Tom Verducci for the record. Just in terms of the surcharge, everything has a beginning and a middle and an end to it. And I know this is a fluid situation, and we're about, by the time the surcharge starts, we're going to be 2.5 years into the pandemic. And my comment or question would be, as far as the exit strategy, what would trigger us to be looking into discontinuing the surcharge? What would we be looking into? Is this going to be indefinite? And what sort of triggers would lead us as a board to discuss discontinuing the surcharge?
So, Laura Rich, for the record, at this point, the surcharge was approved for the upcoming plan year, and it was only approved for one plan year. So at that point, moving forward, at the following plan year, we'd have to have those discussions again.
Thank you, Executive Officer Rich.
Okay, any other questions? If not, we'll move on to, I believe, staffing.
So staffing, PEB unfortunately has not been immune to the staffing issues that have plagued, I think, just everybody nationally, not just labor shortages, but also because of COVID as well, people being out with COVID and being sick. And and not being able to come into work. PEB currently has 8 of 34 positions vacant. We're likely going to have 9 due to a retirement. And getting those open positions filled has been very challenging. So the first obstacle, and this is not at all the fault of the Division of Human Resource Management, they are also going through the same painful transitions with their new system as well. But there's, longer processing times associated with just, getting through that process. And then once a candidate list is finally received, many of the best candidates are no longer interested. And so we have had to, in some cases, repost jobs several times, or even consider an underfill position. So, it's definitely been challenging on that side. Then additionally, COVID infections and exposure have led to obviously absenteeism. This has had a very significant impact on our member services unit, which is our call center, because they're already understaffed and the positions are unable to work remotely because of just the nature of what they do. And so if anybody has been exposed, or if they come down with COVID or any kind of absentee issue, on top of already being understaffed, they definitely feel the pain on that. I know we've been really proud that in the past, we'd answer calls very, very quickly. The whole time was very short, if at all. And that is not the case these days. It's taking a lot longer for members to get through, for members to get service at all because of the issues that we're having. And so our staff is, especially in that call center, are working hard and frustrated at times as well. And with that, I do want to say that the additional volume of just work in general that is happening at PEB, as well as the numerous implementations and changes that are taking place, staff have been overwhelmed. It has been a huge undertaking, and I just want to publicly thank all of the staff, because everyone is putting in 100% effort here, and from the top to the bottom, they're putting in 100% effort, and despite all of the challenges, not just staff, but our vendors as well. I know some of our vendors, with all of these changes that are happening, they're also impacted by this as well. So we've got a lot of our vendors who are working really, really hard to make sure that PEB is successful as well, and they're also handling COVID infections and staffing shortages as well. So, I want to make sure that that's emphasized, because the team here is working really, really hard to do what we can do and to ensure that our mission is accomplished. The last thing is legislative committee meetings. I did want to bring to the attention of the board that we do have 2 pretty big important meetings coming up. On February 8th, PEB is scheduled to present at the Interim Retirement and Benefits Committee, which is IRBC. This is a statutory requirement of PEB. We present a series of reports regarding the prior year's performance. But I believe last year we started doing this, where even though it's not a statutory requirement, we have also presented the committee with information on what PEB is doing the upcoming plan year as well. So I think that helps. I think it helps the legislators understand what is coming to them in the next session and what they're going to be dealing with, and keeping up with all things PEB. But it also helps, I think, staff understand the appetite of legislators as well on certain issues. And then also on the 9th, the following day, PEB is scheduled. We are on the agenda for the interim finance committee. And this is where IFC will be reviewing the $8.7 million work program to use those funds from excess reserves to restore the plan benefits as was approved by the board in December. So any questions there? All right.
Thank you very much. If there are no questions from the board members, this is an info item, so we can just move on to agenda item 6. Enrollment and eligibility system implementation update from Mr. Proper, the operations officer.
Thank you, Chair Freed. Can you all hear me? Can you hear me?
Yes, we can. Thank you.
Okay. Nick Proper for the record. I will be presenting the enrollment and eligibility system update. PEB's new enrollment and eligibility system is called Benefit Place, which is managed by Benefit Focus, went live this month. And although PEB's contract is with LSI, the bulk of the work is being subcontracted to Benefit Focus. And as with implementations and system changes, there will be successes, challenges, and things needing to be fine-tuned after going live. So I will first present the successes. So Benefit Place, the admin and member portal, worked successfully on day one with members and admin staff able to successfully log in. And if you remember, in November, we had a voluntary benefits special enrollment period, and those elections were also processed correctly, and correct health coverages and elections processed correctly and displayed for most members. With the creation of demographic file integrations with the state's 2 biggest pay centers, Central Payroll and NSHE, employees with demographic changes and HR representatives entering those changes now only make those changes in their respective systems as opposed to also in PEB system, which was prior, they had to do it in 2 places, now just 1. So ideally, this should increase efficiency and reduce administrative errors in the long run. And before I get into the challenges, I just want to emphasize that over 90% of PEB's members have had no coverage issues or discrepancies or problems from this implementation. So now to the extensive list of challenges. The first being member data discrepancies. So with system changes, data integrity and reconciliations are part of system go-lives. And with this, there have been some discrepancies on member accounts, including a very small number of members missing in the system, statuses or coverages incorrect from the prior month, incorrect HSA contributions, and incorrect subsidies applied on some retirees' accounts. Many of these have, at the time of writing this, many of these have already been corrected as of today, but there are still some that were being worked out. So PEB staff and Benefit Focus staff are doing their best to reconcile these accounts and resolve the issues immediately, including performing urgent updates with the carriers, with the vendors, so members can access services. But at this time, we do not have access to prior historical information. That'll be coming in the next week. So PEB must rely on Benefit Focus to investigate and help resolve the bulk of these issues by auditing and reconciling data from PEB's previous vendor. And with the integration of demographic files with Central Payroll and NSHE, this should improve many of these discrepancies shortly, but the downstream effects on the accounting and billing side will continue until these issues are resolved. Continuing with demographic data, as I stated, this implementation focused heavily on demographic file feeds with those 2 centers, meaning Central Payroll and NSHE. And the idea was that those agencies know what statuses their employees are supposed to be in. And while we hope in the long run this will be a benefit, this has contributed to some discrepancies, as the new system does not allow staff to manually make certain changes on members' accounts directly, because any information coming over on demographic file feeds will override any of these manual changes. So we're currently fine tuning some categories on demographic files to make sure this is not a long-term problem. Now to the biggest issue, which is related to accounting and billing processes. Currently, PEB staff and PEB members do not have access to the billing platform to view or even make payments. We had to produce January invoices based off of December data for direct billed members and direct billed groups to send payments to, which could potentially miss newly direct billed members for this month. And PEB uses enrollment reports to pay vendors, make tax payments, project budget revenue expenditures, and build budgets. And without accurate and timely enrollment reports, those functions are affected, causing heavy reconciliation efforts by agencies, accounting staff, and vendors. And I just want to call out another issue is premiums and deductions are also inaccurate on some members' accounts due to these discrepancies. And PEB premiums are always not always an even number. So deductions for many central payroll and NG employees are going to be off by 1 cent due to benefit focus having to round to the nearest cent because of their system functionality, only being able to split deductions 50-50. And so with these billing and accounting issues, it's causing, again, heavy reconciliation efforts with frustration on staff, DHRM, NSHE members, and just agencies across the board. And so Benefit Focus is working to address the rounding issue on adjustment files and possibly with the new plan year in July, reverting all deductions being taken out in one lump sum, which is how we did it prior to January. And they're also working internally to solve and finalize the rest of the billing processes and then report back to us in the upcoming days for a status update. As I stated earlier, Benefit Place is the name of the new portal for members and admin staff. And so on the admin side, we're not really looking at it as a true CRM system in that staff are accustomed to more user-friendly functionality that this system currently lacks. Basic functionality such as creating notes on a member's account, responding to messages, and processing eligibility events all now take much longer to accomplish in the system. And so because of this, internal operational processes and procedures take longer, which means coverages take longer to process and also means staff being on calls longer, contributing to longer call times and people having to wait in the queue longer. There are some future development and process changes that are addressing some of these issues, but some will also remain just due to the way the functionality of the system is built. And with those issues, it could cause potentially other downstream effects, which we're hoping to avoid. One includes the July 1st Smart 21 integration go live with DHRM, and LSI has been in communication with OPM to address these concerns. And a possible other issue with all of the previous delays and issues is this could cause challenges in appropriately implementing the board-approved COVID surcharge on unvaccinated member accounts beginning in July. And we're working diligently to address all of these implementations, and we're beginning open enrollment discussions to get ahead of this already. And so with everything already stated, the enrollment eligibility contract with LSI includes performance guarantees related to implementation. As a result of the missing functionality and data discrepancies that impact member accounts and staff's ability to perform the mission of the agency, PEB is considering the assessment of penalties, with the maximum penalty being $10,000 for each of the 2 performance guarantees. We have a recommendation on this report to assess performance penalties or to assess the proposed service credits that they'll be presenting right after I am. And because of this, PEB has discussed the various concerns and issues with leadership at LSI. And as a result, LSI has offered to propose alternative service credits, and they'll be presenting a report. And so with that, we have Scott Meir and Amy Winters with LSI and Benefit Focus on hand to present their status report, including updates, mitigation, and those proposed service credits. So I can either pass the presentation off to them.
Yeah.
Okay.
No, I'm sorry. I'm thinking out loud, Mr. Proper. I apologize. This is Laura Free for the record. I think what I would like to do is open it up to board members if they have questions on your staff report first. So board members, are there, I see a couple of people unmuting themselves. Member Aiello.
Hi, this is Betsy Aiello for the record. And Nick, I would like if you could address if a service credit or a penalty is more advantageous, or is the bottom dollar line what should be looked at? I mean, we'll listen to both reports, but if we're going to have option A and option B, I wouldn't know if they're apples to apples. Thank you.
Right. So the amount that will be in the report from LSI on the service credits is a lot more than the performance guarantees. So that amount is much higher, if that's your question.
The bottom line is, because it was something like 80,000 something, I can't remember. And if we have two penalties of 10,000 each, that's 20,000. Does it, but is a 20,000 penalty actually more advantageous because it can be used different than a service credit? Or that's the kind of thing for final decisions I would like to know, versus if it's dollar for dollar even, then it would make sense which way to go, but I don't know.
Nick Proper for the record. Oh, go
ahead. Laura Rich for the record. Betsy, it's irrelevant. Either one, it is applied the same.
Okay. I have a question for Nick. Okay, so you talk about, in this report, you talk about member data discrepancies, and then under impact, volume unknown is because staff only find out when members contact PEB. Reported cases are around 100, but it seems like the data file errors have led directly to the accounting and billing errors, which are numerous. Do I have that right? Am I reading this correctly?
Nick Proper for the record. Yes, you are. So
Okay.
that 100, that amount that I listed as 100, those are self-reported issues of members calling in.
Okay.
Yes, but there are other buckets of people experience different issues, such as subsidies on retiree accounts, which that number was much higher.
Okay.
That was roughly 1,000, and that issue was resolved a couple days ago.
Okay.
Yes.
So we have, so retirees are not having their entire premium deducted from their PERS checks anymore. They are now getting their subsidy credit.
Nick Proper for the record. That is correct.
Okay. That's a relief. Okay. Just this morning, I received an email from the central payroll staff indicating that about 60% of the total people who participate in voluntary benefit deductions have problems with their voluntary benefit deductions. What is the remediation plan for that issue?
Nick Prober for the record. LSI and Benefit Focus is still working how to mitigate that, but what caused that was, I'm going to try to answer this delicately.
All right.
Was a lack of just communication with prior vendors on what was needed for DHRM to stop those deductions moving forward with Benefit Focus.
Okay. All right. Okay. I'll probably ask LSI and Benefit Focus to answer that, but I see that Member Kelly has her hand raised. Please go ahead, Member Kelly.
Thank you. I guess I have along the same line, just a bit of a detailed question, Mr. Proper, Michelle Kelly for the record. You mentioned that the system's not as user-friendly for PEB staff. And in the past, because some of the family premiums are so high, and you know, we end up in arrears when new hires come on board because, you know, they're essentially eligible at NSHE. We usually hire on the first of the month, so they're kind of eligible immediately. So we end up a couple of months in arrears just with the processing enrollment and then submitting PEB actually charging participants. So some participants end up, you know, thousands of dollars in arrears, or at least 1,000. So I'm just wondering, does that mean that, and PEB have always worked with employees so that they can catch up in a fiscally responsible manner rather than having to pay the full arrears in 1 month. Is that going, the new system, the difficulties PEB staff having, making notes and things, is that going to impact your ability to do those incremental catch-up charges? Sorry for the long-winded introduction.
Nick Proper for the record. Unfortunately, that's actually really hard to answer because we have no visibility into the billing platform at all right now. So I would love to give a direct answer, but we can't even see that information yet. So that will contribute and is contributing to downstream effects and reconciliation efforts. Absolutely.
Okay. So just as a follow-up then, is that issue already on your radar to be monitoring so that we can continue to be a bit user-friendly for our participants who do end up in arrears, those catch-up amounts? Because I think from NSHE's perspective, you know, I'm sure the state as well, you know, and especially now that we're adding subsidies on top of that for some employees, you know, these catch-up arrears can be really difficult for employees to navigate. So I would just ask if it's not already on your radar to make sure you have the ability to do that, to really put a priority on that, because I know that we utilize that service a lot. But thank you.
Nick Proper for the record. Yeah, billing is the concern and priority right now. Absolutely, Michelle.
This is Carrie Eaton for the record. I just like to add a little bit. So because NSHE and the higher education and central payroll are integrated through their files right now, even though we can't see into the system, our understanding is those are being generated properly. So there should not be a lag on those ones. It's the members who are directly billed, who are not receiving anything. So we've had to ask them to pay their December bills again, and in hopes that it hasn't changed.
And Nick
So
Proper
hopefully that helps.
Nick Proper for the record, to continue on what Carrie said, those members that are direct billed are a small population compared to the bulk of the employees that are under central payroll and NSHE.
Ms. Karin?
Yes, April Karn for the record. Just curious as to how we're handling this proactively. Are we reaching out to members that could possibly be impacted? What kind of outreach is happening? You know, from a project perspective, the last thing you want is for your members to bring it to your attention. You want to be able to bring it to their attention and show them that you are aware of it rather than waiting for it to escalate. So what kind of plan is in place for that?
Nick Proper for the record. I definitely understand the frustration because PEB staff is very frustrated that we can't just run a report and just pull all of these members. We don't have information from last month, meaning December yet. And we're going off of data that Benefit Focus has conveyed to us. And so if there is an issue, we have to reach out to agencies because they're typically the system of record on their employee statuses. And so it's causing a lot of manual work. I understand that we should be reaching out, but we don't have a report on who to reach out to with what problem, because there's various problems all across the board. So we're having to rely on LSI and Benefit Focus to assist in these efforts.
Ms. Biddleston, unless Ms. Karin has a follow-up.
No follow-up.
Okay.
Thank you.
Leslie Biddleston for the record. I think a couple of things are pretty shocking in Mr. Proper's report. And one of the things that really stands out to me is that staff do not have a way to go in and look at an administrative portal, so to speak. And to me, this should have been ready upon day one. So I guess what I'm doing is I'm making a comment, a proposal, so to speak, that I think there should be some penalties, maybe put LSI on a corrective action plan with some really strong, firm timelines. And if they, penalties up front for, not having some of these things ready, but a corrective action plan to get them into compliance, because this seems to be, I mean, this is so important, especially when Laura Freed, our wonderful chair, mentioned that 60% of folks are having problems. I mean, if it was less than 10% or 2%, I don't think, I would be making this strong of a statement, but when it is so high, 60%, I think we need to start assessing, put them on a corrective action plan and start assessing some penalties for especially things that weren't even ready on day one. Thank you.
Nick Proper for the record. I want to clarify that 60% is not 60% of PEB's population. That 60% is 60% of people with voluntary benefit elections, which is much smaller than the entire state population.
Right. Yes, that's true. That's about 6,000 participants, if I'm not mistaken, Mr. Proper.
And for the record, yes, that is correct.
Okay. I mean, still, I mean, 100 participants having problems is too many.
Is too many. So I amend my statement. My apologies for my misunderstanding. But again, I still think that it is extremely problematic that we do not have an administrative login on day one. And, and I do think that some penalties need to be assessed.
Nick Pro for the record. I also want to clarify, we did have access to the admin portal on day one. We did, it's just, we're going by the data that's in that system as the source of record and relying on feedback to say, no, this is incorrect, my account is incorrect, right? So we're looking at a member's account in the new system, hoping that that is correct, given the prior data transition and data files being sent from our prior vendor, assuming that that was correct data as well. And so we do have access to the system. We just can't tell if it is incorrect or not. Hence, Benefit Focus and LSI doing heavy reconciliation efforts with all of the data feeds.
So a follow-up to that, Leslie Biddleston for the record, is there was no quality assurance review of the data transfer or something like that. I'm just trying to understand where the problem is, I guess.
Nick Proper for the record, some of these were a timing issue for new hires or status changes in December and January. For employees that had no status changes prior to December, there were no issues on those members' accounts, just timing issues from sending data from the previous vendor to Benefit Focus. Things were not necessarily accurate coming from the prior vendor.
So to follow up, we did a good job with long-standing members that had no changes. That was all fine, but it was these folks that had some changes. Maybe could it be because they selected a different plan or they were new members? All of those folks are what we're talking about?
Nick Proper for the record, yes, you're correct.
Okay.
New hires, newly retirees, people electing COBRA or having a qualifying life event to change their plan or tier. So in December or early January, some of those is what caused some issues, yes.
Okay, thank you.
All right. Board members, additional questions for the staff? Okay. So, Mr. Proper, is the staff's recommendation then to accept the credit to PEB of $87,618.50 as presented in the LSI benefit focus report as of January 21st?
Nick Proper for the record. Yes, that is correct.
Okay. All right. And that represents that represents 1 month of per member per month cost for this contract. And we would forego the $20,000 in penalties.
Nick Prober for the record. Yes, that is
All
my.
right. Okay. All right. Well, I guess the thing that I want to know, and I think that, and if I could, getting the sense of the frustration of the board and getting a sense of the frustration of the participants, including those that have contacted the governor's office, is, when will all of this be worked out? And it says, and maybe we have current statuses as of January 21st, so only 6 days ago. How confident that is PEB staff that these issues, including the voluntary benefits one that I was made aware of this morning, will be actually settled, the tickets handled, and by the end of February, as this report seems to contemplate. It's one thing I guess to, accept $87,000 from the vendor in credit. It's another thing entirely to, but that doesn't mean anything for the people on the end who are having, their PERS checks messed with, or the employees who don't have the right voluntary benefits. It's more important, I think, to me and to the board and to you guys on the staff that this actually gets fixed. And so how confident are you guys that this is going to get fixed in the next month?
Nick Proper for the record. I would love to say that we're feeling confident, but we're not. That's the unfortunate reality.
Okay.
And the challenges that we had last week are no longer the same challenges we're facing this week.
Okay.
And next week, there's going to be new challenges that we didn't foresee. And just, we're in a bad spot, Chair Fried.
All right. You know what? I appreciate the candor. It's most important. Ms. Conran.
Yes, April Karn for the record. So to that point, I do question then the status of yellow for your project status report. I mean, I'm looking at it here. It shows that you're yellow. Everything I'm hearing really points to red. We have data validation issues, data quality issues, billing issues, visibility issues. I just, maybe perhaps you could give us a little bit of background as to why a decision was made to go yellow with this, but I just am having a hard time understanding that.
Nick Probe for the record. PEB staff was not involved in the decision of green, yellow, or red, but to be clear, 90% of the entire PEB's population is having no issues.
Okay. I guess that's a question for LSI to respond to then, and I'll let Mr. Muir chime in.
Right. So thank you, Chairman Fried, and thank you to the board for allowing me to present and talk to you guys today. For the record, Scott Muir, I am the program director for both on the LSI side for both the PEB project as well as the Smart 21 project. And I appreciate the comments that have been given today. I want to speak to all of those and take your questions to make sure that when we leave this, you all feel comfortable about the sense of urgency, about the resolutions that are being put in place, about the specifics around some of these items that have been mentioned. To start off with, the question was just mentioned about yellow and red. This was a call that we made, to Nick's point. we really have two parts to this. We have 46,115 members of the state of Nevada in the system right now, and we're processing benefits for those. We did meet the go live dates, although there were challenges around that, which I will speak to. So to your point, there are aspects of this, no doubt, that are in the red zone, and I'll speak to that. There are aspects in the green zone, as Nick's mentioned, that, you know, we tried to take a balance, and we could have moved it more to the orange, but I think the meter really is more about how we're handling all of these and categorizing all of these issues. I think these fall into three areas. And I don't know if the board, I believe you've all read the report, and I appreciate the opportunity to submit the report to the board. So I won't read through all of those. I'm happy to speak to, along with my partner from the benefits focus side, Amy Winters, any of your questions. But I just want to kind of take these down the line and just kind of set the tone first of all, and love Nick to agree or disagree with me. I think we've had enough conversations with the leadership team in PEB that we're really in a stabilization of a project of this nature. We're in a stabilization and maturity period, and transitioning from a previous legacy vendor and technology over to this new benefit marketplace. And while we want to make that time period as short as possible, there are going to be issues like this. So having said that, there's three buckets: data. So based on what I showed you in the report, I'm confident, and Amy can tag on here as well. There has been an entire triage team on the benefit focus side dedicated to going through the reconciliation between the data that we got from the previous vendor and what we are putting into the system right now. And I'm not trying to throw the previous vendor under the bus or anything. It's just the way these projects go. The quality of the data and the responsiveness of that previous vendor was problematic. We all tried to work around that, but in the project of this nature, to get the data into the system, you have to take the latest production-based data, which is at the very end of the chain prior to go live. When we got that data, there were certainly mismatches of that, and we have been working through that process diligently every day, night and day in some cases, to try to help figure out where all these mismatches are coming from. I'll ask Amy to comment because she just has the latest as of last night. We get and by the way, we get a status report every day on this from the benefit focus team about what they're finding and what they're correcting. And Amy, I believe we're in the final period of being able to go back to PEB and say, from the data that we had, both in the health scope system, which was the previous vendor, as well as the HSB system, we're fairly 99%-ish, almost 100% into the mode of full reconciliation. Amy, would you agree? I don't know if Amy can talk. Amy, are you there? Okay. I will follow up with the board, but that was the last of last night. So I believe the next iteration of a status report back to the PEB leadership team is that we're at almost at the end of the chain of the data reconciliation issues. By the way, if you noticed in the report, as part of our engagement on this project, we are meeting with PEB on a daily basis. We have a 1-hour triage, both from an operational tactical perspective, and now we're implementing a more daily call with leadership around these big implementation challenges. So that's the data part of it. And hopefully I'll stop there because you may have questions on that before I go to the billing piece of it.
Hi, Scott. Can you guys hear me? This is Amy Winters.
Yep, Amy, now we can hear you.
Okay, apologies for the technical difficulties, and thank you for the opportunity to share some of this information and answer questions. Chairman Freed, thank you for that opportunity, and the rest of the PEB board as well. Scott, I wanted to go back to your question. Yes, that's correct. We are at the tail end of trying to actually reconcile and make the corrections in the system.
Great, thank you, Amy. To the board, any questions relative to the data piece of this?
This is Leslie. May I ask a question? Sure. So having gone through this myself, I guess we call it a data migration from one system to the next. One of the lessons that I learned in doing that myself with a case management system is the vendor, the old vendor and the new vendor, didn't really have a one-for-one data match. And what I think was a lesson learned is that was not fixed prior to the data migration. They knew it existed, but they did not fix it prior to the data migration. So that's what I'm hearing you say, is that, you know, once the data migration was made, there were errors in the system, or bad data, or dirty data. So my question or comment, maybe it's more of a comment, that as a new vendor, maybe a lesson learned would be to fix some of that stuff up front so we have less data errors, or to have the old vendor go back and you know, do some data cleanup, things like that. Because like I said, it is extremely frustrating when you've got that issue where you say, well, the data migration was unsuccessful. So I think that I understand it, but I think there's fixes, and I think we can do better. That's all I wanted to say. Thank you.
Yep. Well, thank you, Leslie. And I agree with you. We did a run with them prior to production where we did test some of this. But as you probably in your experience, when you get to the final end and you're in dealing with production-based data, and now you're having to reconcile what's in one system that should be in another, that's kind of where this is all falling out. The good news, and again, I would ask Nick to confirm for me, is that we're dealing with the exceptions, not the masses. And while that's very troublesome or problematic for members, because this does affect them, I would also say to you that I'd ask the PEB leadership team to confirm for the board, anytime that this has been brought up to our attention, it's an immediate all hands on deck. Let's go figure out why this is occurring. Let's do the manual corrections for that member. Let's re-communicate back to them that this is fixed. So there's a sensitivity that, you know, we understand what the downstream effects of this, and we're trying to jump on it as fast as we can. And we're trying to minimize those events. And I think we're getting to the end of the road. And we will keep the PEB leadership updated, and certainly that I'm sure will flow to you all as the board. Is there any questions before I move on beyond data? Okay. Billing. Absolutely on behalf of Benefit Focus, this is a miss for us. Billing was originally supposed to be tested and fully vetted back in the November and December timeframe prior to go live, to provide PEB and Carrie and her accounting team the visibility for what they needed to do on paying vendors, accounting for all the charges and that type of thing. In full transparency, we've run into issues around the logic configuration of the subsidies that drive billing. And there's been a lot of detail to go back and figure out, do we have all the subsidies matched? Are we sure we're all in line with the logic that needs, because it's a very complex, because it drives eligibility around the whole billing piece of this. So absolutely in transparency, this was a miss for us. To Nick's point, and up until recently, we've had to, as a workaround, suggest to PEB to use December billing. As of today, I can report to the board and to PEB, PEB leadership, I haven't got to you this morning, and I believe it's today, Amy, that we have a meeting on the calendar this afternoon to demonstrate to Carrie and team the member report, so that she has complete visibility to the member enrollment. And that will be a big first step in this whole, being able to reconcile the billing until the full billing platform is up. Amy, I'll stop there. Is that correct?
Yes, Amy Winters for the record, that is correct. We're planning to share the headcount report and review that with Carrie. We sent that over to her this morning. So looking forward to feedback on that.
Now that's just one step of the process. Amy has been great on her side of the Benefit Focus to create a very dedicated triage team for this. And as you see in the report, we're working toward a resolution to get the full billing platform reviewed by PEB staff, approved by PEB staff, and launched in February. I think February 14th is the current target date for that. And our really end goal is we have to be able to get Carrie and team the billing platform functionality by the 25th carry, if I'm not mistaken, because that's the next cycle period for the next billing that will come out. So we're all marching toward that. And I think that was one of the biggest proactive issues on my part, to say, yes, we could go by the contract, and yes, it's $20,000, but this was a miss by LSI and Benefit Focus. And so we know the sensitivity of this. We wanted to own up for our responsibilities, and that's one of the reasons you saw the credit that we proposed in the report. I'll stop there. Any questions on the billing piece? Okay. Last is, I would really put this in the bucket of usability. I think Nick referred to this as the additional lack of efficiency or somewhat burden on the PEB staff from an operational perspective. We believe the functionality is there. I think when Amy and I have inspected this, there needs to be a lot more training and knowledge transfer and enablement that we need to do with the PEB staff. So we've owned up to that. I think we're trying to take care of the big buckets, the data and the billing right now, but we certainly communicated to Laura, Carrie, and Nick the commitment, if you will, to start a more in-depth knowledge transfer training program for the administrators of their team to get to where they can do true case management and have the data in their possession and work through the process, right? Because it will be a big miss on our side if that can't happen, or at least we can't facilitate that. So fully acknowledge the frustrations on that piece. I think with everything else going on, it kind of got dropped to the back end, but we wanted to bring back that to the front end, because when we get these other two fixed, we should be able to get to that piece. With that said, my final, I guess, summary is we're trying to make the stabilization and maturity period as short as possible. And we're fully, and Amy can correct me if I'm wrong, both teams are trying to get through this next month at most to get all of these issues fully addressed and resolved, so that by the time we get to the end of February, we can confidently say that the new benefit place system is effectively working for all members, the data is correct, and the PEB administration staff is being able to use it effectively. With that, I'll turn it back to the board.
Okay, thank you. Well, this is Laura Freed for the record. Gosh, I don't know that we have much to do here except for accepting LSI's offer for the credit, and just re-emphasizing to everyone how concerned the board is that this actually get on track and completed by the end of February. If there's other discussion by the board members, I'm happy to hear it. Otherwise, I would accept a motion to accept the credit to PEB as specified, the $87,618.50.
Chair Freed, is there an appetite for the board for this to come back at each board meeting and update from LSI to, okay.
Yeah, yes, definitely. I mean, we don't have a February meeting, we have a March meeting. So I would love to know at the March meeting that this has all been resolved and that we don't have any more unhappy participants. Oh, Ms. Biddleston, please.
Yes, so first of all, I want to thank Mr. Muir for taking ownership of the misses, and I agree with Ms. Collin that we seem to be more towards the red. With that being said, I do want to make, I guess, two motions, or maybe one big motion, that we accept the request of repayment or credit, however we want to say that, and have LSI report to us at the next board meeting with the thought that if some of these things are not fixed or everything is fixed, that we request credit again. So I guess I'm trying to throw all of that into one motion.
Thank you. That sounds good. Before I ask Mr. Muir to weigh in, I'm going to ask that if there is a second on the board for that motion.
Linda Fox, for the record, I'll second the motion.
Okay, thank you, Vice Chair Fox. Mr. Muir.
Yes, Chairman, I totally agree with that motion and support that. If you will indulge me, I forgot one critical item that you brought up and others, which was the voluntary benefit missed deductions that were reported through central payroll. And I just wanted to give you all kind of a clarity on that because that's being fixed as well. Specifically for everybody, that is the deductions that were being taken out prior to the system going live in the old system, which was the Liberty Mutual deduction for insurance for voluntary benefits. And as Nick has mentioned, what was the transition between the old system and the new system, the stop deductions did not get taken out, which we didn't, it's not in our system, so we didn't have visibility on it. Now, having said that, we're happy, we're trying to work with central payroll because what's happened is those deductions were taken out. The money was sent to Benefit Focus by mistake. And now we're trying to work with central payroll to both find the refund method back to the employees and find the refund method that works for the state to get the money back to you all because it should have never came to us. So I sent out an email to Kina this morning at central payroll and said we were going to have a meeting. We need to get everybody on the same page. Hey, how do we do this? Let's go do this. We're on everybody on board to go do this. So I just wanted to report back to you on that as well.
Okay, thank you. Okay, board members, it has been moved and seconded to accept the credit to PEB in the amount of $87,618.50, as well as require a report back at the next board meeting on the status of all of this. Is there any discussion on the motion? Okay, hearing none. All in favor, signify by saying aye.
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 Any opposed, no? Okay, motion carries. Thank you very much. With that, I think we can take a little break if the board would like to before agenda item 7, maybe a 5-minute break or something. Okay, why don't we do this? Why don't we come back at 11:30 to tackle agenda item 7? Thanks, everybody. Okay, ladies and gentlemen, this is Laura Fried, and it is 11:30 a.m. So let's call the meeting back to order. And I will call on Carrie Eaton, the Chief Financial Officer, to discuss contracts.
Thank you, Carrie Eaton for the record. Item number 7 addresses the status of contracts. So if Chair Fried agrees, I would actually like to address item 7.2 last in this report, as we need to close down the meeting to address the new contracts. So would it be okay for me to proceed out of order?
It would be fine to do 7.1, 7.3, 7.4, 7.5, and then we'll go back to 7.2. That sounds great. Thank you.
So 7.1 is just an overview of the current active PEB contracts, and no action is necessary. So I will move on to item 7.3. And item 7.3 is requesting the PEB board approve a contract amendment to the Express Scripts contract. PEB contracted with Express Scripts for PBM services, which became effective April 12, 2016, and has a termination date of June 30th of this year. This amendment increases the contract max from $291 million to $303 million. This increase adds additional authority to pay claims, since claims costs have gone up through the remainder of the contract, in addition to adding authority to implement the optional Medicaid subrogation program that was included in the original RFP response. The Medicaid subrogation program is required pursuant to the state statuses implementing provisions of the Federal Deficit Reduction Act of 2005 pertaining to Medicaid third-party liability. Third-party insurers and their pharmacy benefit managers are required to furnish state Medicaid departments or their contracted agents with enrollment and eligibility information sufficient to enable Medicaid to identify instances in which an individual is covered by both Medicaid and by a private insurance, such as PEB. So therefore, those insurers may have third-party liability for a Medicaid claim. So PEB recommends the board authorize staff to amend the contract between PEB and Express Scripts to add the Medicaid subrogation program and update the fee schedule and increase the contract maximum.
Okay, thank you. Board members, any questions on 7.3.1? Okay, hearing none, I will accept a motion to approve the staff recommendation.
Betsy,
Michelle Kelly for the record. Oh. So moved.
All right, great. Do I have a second?
Second.
Sounds good. All right, it's been moved and seconded to authorize board staff to amend the contract between PEB and Express Scripts, contract 17551, to add the Medicaid subrogation program, update the fee schedule, and increase the contract maximum. All in favor signify by saying aye.
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 Any, oh, I'm sorry, give you all a chance here. Any opposed, say nay. Okay, motion carries. Let's move on to 7.4, 7.5.
Thank you, Carrie Eaton for the record. Item 7.4 are contract solicitations, and thankfully PEB does not currently have any contract solicitations for ratification. And 7.5 is an overview of our current in progress contract solicitations, and no action is necessary.
Okay, thank you very much. With that, we'll go back to new contracts and pursuant to NRS 333-475, because we're going to be discussing financial offers submitted by bidders, we have to close the meeting. So board members, staff, Deputy Attorney General, purchasing staff, and vendors, if you've received the credentials to log into the other Zoom meeting, that is the closed meeting, go ahead and log off of here and log into that one. I'll give you about 5 minutes to do that. And you can, and everybody who is listening from the public, you can see the closed session is not expected to return to this meeting until after 12 noon. So with that, I will see you all over there.
All right, everyone. Welcome back.
Tyler, are we ready to go?
Yes, we are, Madam Chair, whenever you are.
Okay, thank you. Okay, it is 1 o'clock and we are calling the public portion of the meeting back to order. We were in closed session. We have finished that. And we will go again to item 7.2, new contracts. And so the question before the board is selection of pharmacy benefit manager between Express Scripts pursuant to RFP 95 PEBP-71711 and Northwest Drug Consortium pursuant to NRS 333.475. So board members heard a presentation from our actuary. Once again, thank you to Aon for that. And now I will turn it over to the board members to make their choice. Mr. Verducci.
Yes, thank you, Chair Fried. I would like to make a motion to approve eScripts ESI to provide pharmacy services beginning July 1 of 2022, including their best and final offer and modified performance guarantee.
Do I have a second for that motion?
Leslie Biddleston will second.
Okay. All right, it's been moved and seconded to approve a contract for pharmacy services beginning July 1st, 2022 with Express Scripts Incorporated. All those in favor signify by saying aye.
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 Any opposed, nay? Okay, motion carries. Thank you very much. Ms. Eaton and Ms. Rich, did we already do 7.5?
This is Carrie Eaton for the record. Yes, I believe
We did. Okay. Okay. Then it looks like we are done with agenda item 7 and we can move on to agenda item 8. This is the second public comment period. Again, comments are limited to 3 minutes per person, and I will turn it over to PEB staff.
Thank you, Madam Chair. For those who have joined for public comment, your name and last 4 digits of your phone number will be announced. You'll be advised you've been unmuted. As a reminder, for those on the phones, please press *6 to unmute. Please slowly state and spell your name for the record and proceed with your comments. Okay. Last name with Gutierrez. You have permission to speak. Please unmute your mic.
Hello, can you hear me?
Yes, we can.
Okay, for the record, my name is Tony Gutierrez, Gutierrez. I'll start my comment with reminding everyone listening and the board as well that COVID happened to all of us. It didn't happen to some of us, and it wasn't caused by your neighbor. The next comment I'd have to make would be that to remind the board as well that all current vaccines, as well as tests for COVID, are authorized only under emergency use authorization. Having stated that, I'd like to read the board some language of that emergency use authorization statute. Each individual must be informed of the option to accept or refuse administration of the product, of the consequences, if any, of refusing administration of the product, and of the alternatives to the product that are available and of their benefits and risks. Since no court has ruled on this, the prevailing interpretation of the term consequences, if interpreted through the spirit of the law, suggests that the consequences means health-related consequences, not workplace mandates or surcharges or punitive measures with the obvious goal of mandating the use of those products. I'd also like to mention in regards to the Supreme Court ruling, while they did not directly address whether this board has the authority to do what they're doing, they did reinforce constitutionally that the intention is not for non-elected bureaucrats or board members to address or enforce their public health goals on the public as a whole or employers. I don't believe that the board has the authority or justification to use coercion while interjecting themselves into the personal choice to accept an experimental vaccine. A question to the board: will you change the definition of fully vaccinated? Is that going to be a moving goalpost? The board justifies the use of surcharges for historical use of surcharges in alcohol or tobacco use. I'd like to illustrate a large difference between that and this subject. In those cases, you're trying to discourage an existing behavior in an attempt to negate possible injury that happens from that behavior. And the case that you're trying to make now is you're demanding an action or use of an experimental drug in order to avoid coercive or punitive policy. I also would like to wonder, I have a question to the board. Will you acknowledge natural immunity? The CDC recently acknowledged that in regards to Delta, as the numbers are coming in, it proves to be equal to or greater than in effectiveness of avoiding major illness, sickness, or death. Will you acknowledge that to avoid surcharges? You use the governor's declaration of emergency to justify your actions. Well, that we've been operating under emergency condition for more than 2 years. There's been plenty of time for the governor to consult and utilize the legislative process to when attempting to apply a controversial mandate.
Mr.
So
Mr. Gutierrez, you need to wrap up your comments.
Yes, ma'am. I guess my final statement says your willingness to participate in politics as board members is troubling. I hope more than a vote by unelected panel members will be needed in the future to apply punitive tactics to force me to accept an experimental drug. So thank you for your time.
Okay, for the next public comment, Kent Irvin, you have permission to speak.
Kent Irvin, K-E-N-T-E-R-V-I-N, State President of the Nevada Faculty Alliance. Good afternoon, Sheriff Freed, Executive Officer Rich, and committee members. Thank you for your service today and your dedication to the program. Because my statement of the $47 million in excess reserves as of the beginning of fiscal year 2022 in earlier public comment was questions, I would like to put the values on the record. We have been told repeatedly the excess reserves amount are only meaningful as of the turn of a fiscal year, so those are the numbers I am quoting. The first quarter budget report with the fiscal year closing is being presented for the first time today instead of in November as usual. According to the first quarter budget report in agenda item 4.2.1, the beginning cash balance for FY 2022 was $159,011,280. The mandatory reserves for FY 2022 total $112,217,030. That amount is the sum of the $52.3 million in incurred but not reported liability, $34.9 in catastrophic reserves, and $25.1 in HRA reserves for FY 2022. The difference between the $159 million beginning balance and the $112 million in mandatory reserves is $46,794,250, or about the $47 million in excess reserves as of the beginning of the current fiscal year. In addition, $8.6 million in CARES Act reimbursements that was not known at the rate setting time is being received in FY 2022. That raises the total available to $55 million for new expenditures in fiscal year 2022. According to email correspondence with Chief Financial Officer Eaton this week, the final cash balance for the close of fiscal year 2021, last fiscal year, in the budget report should be $159,000,000 $11,280 instead of the $154.7 million listed in the table on page 2 of the report. That revises the excess reserves as of the close of fiscal year 2021 to $42,111,629. That is up by $9 million from the $33 million that was projected as of the May 7th, 2021 legislative budget closing for PEB. The mandatory reserves were reduced from FY 2021 to FY 22, which accounts for another $4.6 million increase in available excess reserves as of the beginning of this fiscal year. As discussed at the September meeting, the new mandatory reserves were calculated by Aon back in August, although the explanation letter from Aon has yet to be shared with the PEB board despite the request by Chair Fried at that time or to the public. Regarding the table on page 3 of the budget report, it's not clear to me which items allocated to spending down the excess reserves have been included in the budgeted or projected expenses. But only a net $8.2 million of the excess reserve is projected to be spent down this year. Over the past decade, those spend down projections have been greatly overestimated nearly every year. Thank you.
Mr. Irvin? Okay, cool. Thank you, Mr. Irvin. Just on the 3-minute mark. Good job.
Okay, Chair Fried, that was it for public comment. I did start sharing the slide a little bit later. So
Okay.
if we can, maybe just wait a few minutes just to make sure anyone else wants to dial in.
Okay, we will hold for a couple of minutes to see if anybody else has public comment. Also, the slide is showing closed meeting happening now. I probably want to change that.
Apologies for that. Okay, Madam Chair, we have no one else in the waiting area for public comment.
All right, well then, thank you. That takes care of agenda item 8 and talking over my tongue. Agenda item 9 is adjournment and it is 1:13 p.m. And so we are adjourned. Thank you very much, board members, staff, vendors, everybody. Have a good afternoon.
Thank you.
Thank you, everyone.
Thank you.